Good Thursday afternoon, and thanks for watching THV 11 News at Noon. I'm Michael Aaron. We begin now with developing news in Washington, D.C. Capitol Police are negotiating with the man who they say drove up to the Library of Congress and told an officer he had a bomb in his vehicle. This is a live look near the scene there. Investigators say he had what appeared to be a detonator in his hands. They're working to peacefully resolve the situation. The House and Senate are currently on recess, but people working in buildings nearby were evacuated. Stay with us here on THV 11 and thv-at-noon.com for the very latest. Well, let's switch gears, get to meteorologist Scott Covert. And Scott, it has been pouring here in downtown Little Rock over the last few minutes.
It really has. It is a soggy afternoon. It's perfect sleeping weather, to be quite honest. Let's take a look at your Doppler radar. Scanning the skies of the natural state this afternoon, we've been seeing these scattered showers over the last few hours, especially in southwestern Arkansas. A tighter look into central Arkansas shows this broken line of rain showers anywhere from pretty much Clinton back down into Pine Bluff. So folks in Searcy, Cabot, Lone Oak, even Pine Bluff, you've probably not seen much rain yet, but this is tracking in your direction. Moderate, even some heavy rainfall at times in downtown Little Rock, even back towards the west in western Pulaski County. We'll have to keep that chance of rain in your forecast the rest of the afternoon into the evening. Have seen somewhat of a dissipating trend back off towards the southwest. Could see some additional spotty showers. Your temperatures look like this, mid to upper 70s in central Arkansas. We're looking at a high temperature today of 87 degrees. More details on your extended forecast still ahead.
Governor Asa Hutchinson is expected to tackle several big topics during today's COVID-19 press conference. Those include the ongoing surge and its impact on the new school year. More than 2,600 new COVID cases were reported on Wednesday in Arkansas. That is the biggest jump we have seen in one day this entire week. 1,372 people are still battling the virus from a hospital. That's 38 fewer than Tuesday's total, and the second day in a row that number has gone down. Unfortunately, we cannot say the same when it comes to new deaths. 26 more Arkansans have died from complications of COVID-19. You can see the increasing death rate right here. We have lost about 30 people a day over the past week. It has caused a lot of heartbreak for families forced to grieve over lives lost too soon. We introduce you to one of the faces of COVID-19, Stacy Hensley. THV 11's Ashley Godwin tells us about the woman everyone called Mom.
She was just a lovely, happy, bubbly person.
Stacy Hensley was 48 years old, a friend to everyone, and as a healthcare worker, she was always there to help. It wasn't but a couple weeks ago that everything changed for the Hensley family.
She was sitting in that chair and we were just talking about stuff like normal, like you don't know that something so unexpected can happen to anyone.
She was at my house that day for a few minutes. And while she was there, she got the call and she said, "Oh, I've tested positive."
Stacy didn't get vaccinated because she had had serious allergic reactions before. This also wasn't the first time she got COVID. She had it in January, and at the end of July, she came down with the Delta variant, and it would soon prove to be a different battle as she was admitted to the hospital.
We FaceTimed a couple times. That you can't get back there at all to visit them. I think that's one of the worst things about this is you can't go see your loved ones.
She FaceTimed me Saturday before she passed, and she just was wanting to come home because things wasn't getting better, and that was tough, and I couldn't get in there. That's the hardest part. I couldn't get to her.
Stacy died Saturday, August 7th. The family, once reluctant to get the vaccine, now they are all planning to get the shot.
Yeah, the last thing I told her, I texted her, I said I got vaccinated. She said, "Wonderful."
Yeah, I was hesitant. I was one that did not want to take it, but after seeing what can happen, I'm getting mine.
In White County, Ashley Godwin, THV 11 News.
Stacy worked at Searcy Medical Center's COVID-19 test lab. The family tells us her coworkers are putting a plaque up in her honor. New at noon, the Walmart amp will honor ACT's request for additional COVID-19 protocols, including proof of vaccination. Right now, anyone attending the Counting Crows show or the Dave Matthews Band show must provide proof they've been vaccinated or a negative COVID-19 test. The Northwest Arkansas venue says any additional shows that add fan protocols will be announced on its website and on social media. COVID booster shots could be widely available for millions of Americans beginning next month. Studies from overseas show fully vaccinated people are beginning to exhibit worsening symptoms in their breakthrough cases. But with millions still unvaccinated, President Biden announced nursing homes that receive Medicare or Medicaid payments will now need to ensure their staff is fully vaccinated.
With this announcement, I'm using the power of the federal government as a payer of health care costs to ensure we reduce those risks to our most vulnerable seniors.
The U.S. had a total of 400,000 new COVID cases for the entire month of June. We are now approaching nearly 2 million so far this month. The CDC says the number of people getting their first vaccine dose has fallen for 5 straight days. Here in Arkansas, some pharmacies locally have started reopening vaccine clinics this week to keep up with a recent surge. A different story here than nationally. Doctor's Orders Pharmacy in Pine Bluff closed down their vaccine clinic at the beginning of June, but yesterday reopened it to keep up with the demand. The pharmacy went from giving 20 shots a day 6 weeks ago to 200 last week. And you might think this is because of the FDA recently approving booster shots for the immunocompromised. Well, it turns out the owner says that's only a small portion of the people coming in to get their shot.
Uptick has been, I think, primarily because the Delta variant has been so prevalent in Arkansas.
Kavanaugh Pharmacy will also reopen its vaccine clinic at the beginning of September. If you'd like to learn more about the vaccine or where to get one, we've got you covered. Just text the word vaccine to 501-376-1111. We'll send you a link to those resources. Booster shots are a hot topic right now, especially with that September 20th date quickly approaching. And when you throw flu season and flu shots into the mix, you end up with a lot of questions like, should I wait to get one so it doesn't mess with the other? Michael Wilson did some digging and get some advice from Arkansas pharmacists.
After missing out on flu season last year, pharmacies are gearing up and already ordering doses of the flu shot.
We would encourage everybody to start getting it as soon as it's available.
Gary Fancher with Collier Drugs in Fayetteville say people should begin going to their local pharmacies in September to get the flu shot, which is coming on the heels of when a booster shot of the Pfizer or Moderna vaccine should be approved by the CDC.
You can receive multiple immunizations on the same day, including COVID vaccine.
Justin Boyd with Coleman Pharmacy in Alma says people do not have to wait to get their flu and COVID shots. They can get both on the same day.
That it's okay to have the COVID vaccine with any other vaccine.
As we get closer to date, the CDC will put out a final recommendation on this. When getting both shots, Boyd recommends getting it in separate arms.
There's a reason you can't do them in separate arms. You would want to separate them by at least an inch apart.
For kids eligible for both vaccinations, they're given the same recommendations. Pharmacists asking all Arkansans to get both vaccines, afraid of what flu and COVID hospitalizations would do to our hospitals.
I don't want to imagine that. I can't imagine. It's been devastating enough what our hospitals and, as we were discussing, nurses are going through right now.
He says there's 2 reasons we didn't have this situation to fear last year.
We're all wearing masks. Secondly, we weren't going out to different venues so much as we're starting to now.
Both pharmacists reiterate the importance of getting both vaccines. They say we have the tools to keep people from getting severely sick and going to the hospital, and we need to use them.